Delivering her address on Thursday, the United States Ambassador to Sierra Leone, Madam Maria A. Brewer, said that it is a privilege to recognize the results of an important milestone they have achieved in establishing the IPC course at the university since 2016 and encourage the students on their accomplishments to ensure effective IPC practices in their communities and healthcare facilities. She noted that they now have the skills and knowledge that will enable them to promote sound IPC practices in their various communities and workplaces to save lives and promote good health in the country.
So congratulations to the 130 graduates on your accomplishment to ensure effective IPC practices in your communities and healthcare settings. At the end of the Ebola outbreak, the need for an approved and a standardized IPC course was widely recognized as a significant gap. USAID, to fill that gap, provided a 3-year, $3 million grant to IOM in partnership with the Ministry of Health and Sanitation, the University of Sierra Leone, Njala University, and Infection Control Africa Network based in South Africa. They are the pioneers of IPC education in Africa, and we thank them also for their development of the curriculum. I would like to offer special thanks to ICAP of Columbia University, the World Health Organization, and the U.S. Centers for Disease Control and Prevention for their technical oversight in developing the standardized IPC clinical and non-clinical curricula approved by the Ministry of Health. The U.S. government is very proud of our partnership with the International Organization of Migration and the government of Sierra Leone to establish the first university-level IPC course not only in Sierra Leone, but in all of West Africa.
The envoy lamented over the deadly Ebola outbreak disease in Sierra Leone in 2014, adding that the U.S. government has made significant contributions to strengthen the healthcare systems and supports the people of Sierra Leone to protect them from any disease outbreak through preventative measures such as the IPC. The Executive Director of IOM, Mr. Sanusi Savage, said the Ebola outbreak was a wake-up call to improve in our health and sanitation system, which calls for a new approach that emphasizes institutional reappraisal in the form and manner by which services are delivered in our health system. He said that USAID provide grants to IOM in implementing the IPC training in which doctors, nurses, midwives, laboratory technicians, maternal and child health assistants benefit in providing good health system and commended the Njala University administration for such a positive achievement.
Which significantly contributed to the checking the spread of Ebola through the training of about 1,100 different cadre of healthcare workers in 11 districts around the country. IOM approached one of its major donors, USAID, to canvass the idea of institutionalizing the teaching of IPC in the country's tertiary institutions. An idea premised on the logic that an enduring culture of IPC practice throughout all the medical and health system of the country will not only serve as a panacea to the myriads of leukemia observed during Ebola, but will also go a long way to impacting the lives of the population by reducing incidents of phenomena such as infant mortality.
The National Coordinator for the IPC training at the Ministry of Health and Sanitation, Mrs. Nana Sise Kamara, said that IPC was set up in 2015 due to the Ebola outbreak with the help of WHO, IOM and USAID in support of the training. She went further to state that Sierra Leone can now boast as an underdeveloped country with the IPC training course.
The American ambassador to know that we have been working in collaboration with IOM and Njala University and Commerce to put IPC measures in place. How do we do that? By training our people. Because of the sustainability, we cannot really rely on partners to be doing this training, and if everything gets loose and they all have to go back, where is the sustainability? So on that note, I advise my partners, when we are doing this training, can we please train our people so at least everybody or whoever left any educational institution will have an idea about IPC.
Other highlights include a laboratory display by some medical practitioners on how to go about the IPC and final courses by the Vice Chancellor of Njala University, who expressed gratitude and appreciation to all members involved in the IPC, highlighting some of the challenges and achievements in the process. Sarah Calais reporting for Star.